And now I'd like to welcome Marcia Thompson to the conversation. Marcia is a lawyer by profession, focusing on civil rights, but who also has an extensive set of experience covering academia, law enforcement, business, and is also on the board of directors of Social Progress Imperative. Marcia, welcome to you as well. You work a lot with cities. You've worked a lot in cities. You work with businesses. Yeah, how can a tool like the your Social Progress Map help to the challenge of building justice and equity within cities?
Well, it seems like Katie, Sarah, and Becca said most of everything that I was going to say. However, I would say that for me, it would be goal setting. When you're looking at, for instance, I'm in the Midwest, and we just recently got a new mayor, and that mayor put out a strategy. And that strategy has at least 7 or 8 of our indexes immediately listed: education, housing, public safety, and so on. And so when any public professional is looking at where do I align my money, where do I align my goals, and what data am I using to justify that to the public, I think the indicators that we have from SPI allows them to have a baseline. Some cities will have some data. They may have good data on literacy. They may have good data on housing. But do they have the ability to overlay those together and find out where those gaps are and where those most needed communities, most impacted communities, where they have 6 or 7 of the social determinants all in one area? And I think cities could really, really use that as a value add when they're focusing, as Sarah and Katie said, when they're focusing their budgets. When you have a budget allocation concern, and you want to justify why you're putting something one place over the other, our data can at least help you at the macro level, and then very much at the granular micro level, identify those most impacted communities. And I love the comparison aspect too, because not only can we compare those most impacted communities with multiple social determinants, the exact same ones, but we can also look at the ones that are outliers, which I think Becca mentioned early on. You can look at communities that may be economically disenfranchised, but still be an outlier where they have a great education system. And if we look at that community and say, well, they're under the poverty line, but it seems like their kids are scoring higher in education. And then we go in and find out why and use that example. So I think that's what Sarah just mentioned when you do comparison, but even within your own city, you can do a comparison just with the baseline data that we provide. And then, of course, with the work that we do with cities, we supplement with their own specialized data, which even gives you much more flavor for city leaders. They can add their own community data that we may not have access to with our map.
Oh, this is a great point. This is why I loved the couple of neighborhoods that Becca shared in the presentation, was how one was doing so much better. So it actually shows what is possible. Yeah. And it's so we're not victims to income, that even within the resources we have, we could be doing a lot better. And so I think Absolutely. It's not about seeing problems, it's also about seeing solutions, which is so important. Marcia, I need to ask you, given the sort of specialization you have around safety, justice, crime, law enforcement, how do you see the tool working in that? Because obviously health, education, that all sounds like very nice, fluffy social progress sort of stuff. But when it comes to crime, law enforcement, etc., do you see this as a tool that's got an application?
Absolutely. Absolutely, Michael. When you're looking at law enforcement and public safety, and particularly now in the 21st century policing era, police are doing more than just law enforcement. And there's a term out there, a co-production of solutions and problem solving. And so when you're looking at data, that's going to be the framework even for our justice sector, instead of just laying it down to law enforcement specifically, but even our public first responders in general. They're going to be looking at what are the other things that are indicators in those communities that are causing higher violence, more trauma. Right now, there's a huge push nationally for violence intervention. Violence has been considered a public health issue in the United States. And so when I think Katie had mentioned something about working in public health and now looking at a justice indicator, it's because they're very much a correlation. The American Physicians Association, APA, I believe, even said that when you look at inequities in communities from health and other disparities of social determinants, it also connects to violence. And so when you're looking for law enforcement, some of those communities that they're going to be focusing their attention on for violence intervention, there's also going to be interventions necessary for other social determinants, such as housing, such as food insecurity, such as health disparities. When you address all of those things holistically with your police, with your community partners, then you create a much more healthy community in general. And so when I say healthy community, I'm not talking about physical health or mental health or, doctor health. I'm talking about thriving, resilient, healthy communities. And so that's why public safety is one factor in a healthy community. And these other factors definitely will help officers when they're going into those communities to be more resilient and more resourceful and to work with their law enforcement partners.